All right, we have Cindy Dean. She is in room 9. She was experiencing moderate shortness of breath that began while she was laying in her bed after being transferred up here from the emergency department. The patient is also experiencing a productive cough after she has her breathing. She was admitted on 2/4 with pneumonia. She has an allergy to penicillins, and she also has a history of hypertension and COPD. And she states that she uses an inhaler that she also shares with her son. She is on bed rest. She also is a regular diet, full code. She has a single lumen right pick in her lower forearm. I gave her 1,000 milligrams piggyback of vancomycin along with cefepime 2,000 milligrams. She also has normal saline running at 75 mLs an hour. We gave her a breathing treatment with albuterol during her shortness of breath episodes, and those are to be continued every 4 hours or as needed. And I also gave her her treatment with Spiriva, and I educated her on the fact that she's supposed to take her Spiriva, her long-acting, regardless of whether she's experiencing symptoms or not, and her albuterol is only to be a rescue inhaler, so make sure she is well understood on that. Her vital signs was 124/84. Heart rate is 118. Respirations rates were 28. And her temperature is 101. She's now back up to 92% saturated oxygen. She was experiencing saturated oxygen levels of, I think they were like 87%. But we gave her, she's now on 3 to 4 liters of oxygen via her nasal cannula. And now that her oxygen is back up, we kind of want to titrate that according. Her respiratory, she had decreased lung sounds bilaterally. She had shallow and elevated respiration rates. She had a productive cough with sputum culture that we did send off. Like I said, she's on 3 to 4 liters of oxygen via nasal cannula, and she has 2+ edema in her lower extremities. And she's got a very rapid pulse. So what I recommend is that she had an order for Cipro for 400 milligrams, so we need to get that hung. She has an order for an in and out catheter because she's on bed rest, and she states she really needs to urinate, but she just can't in her bedpan. We need to titrate the oxygen based on her oxygen saturation levels, and it would also be beneficial to get her ABGs sent off just so we know where she's standing at. We need to obtain a CBC and a BMP because she is on 40 milligrams of Lasix PO and 40 milliequivalents of potassium. If I said 40 milliequivalents of Lasix, that was incorrect. It's 40 milligrams of Lasix. Both are daily, so we need to check her electrolyte levels and her kidney function because she's experiencing that edema. We're still waiting on x-ray. We haven't got that back, and we also haven't got the sputum culture results back, so make sure that you're checking for that. We talked to her about smoking cessation, but she said that she tried to stop cold turkey with her son, that he continues to smoke, so try to come up with some alternatives for her support options so that way she can have someone to talk to that would be proactive towards stopping her smoking and improving her breathing. So I think that is it. Do you have any more questions for me?